I'm Dr. Richard W. Fleming at the Beverly Hills Institute of Aesthetic and Reconstructive Surgery on Bedford Drive in Beverly Hills. We have put together a series of podcasts discussing cosmetic treatments of the face. Today we're going to discuss eyelid surgery. Let's describe what is natural, what is ideal. If we look at Selma Hayek here, you see the brows are arched above her bony rim. She has a nice convexity down to the eyelid crease, which is very well defined. You can see a small amount of skin below that crease down to the eyelashes. Her lower eyelids are basically barely concave. There's a nice smooth contour of the lower lid margin without any bags or excess skin. When we look at Jake Gyllenhaal here, we see the ideal male eyelid complex. The brows are at the orbital rim and the convexity down to the crease is like a woman but not as full or as bold as a woman. The lower lids in men, many times there is a small crease below the lid margin, as we see in Jake. That's very common, but there's no bags, there's no excess skin, and the lid margin is in good position, not sagging, which we see in an older individual. Whenever we talk about eyelid surgery, we evaluate the eyebrows, the upper and lower eyelids. Many times the brows are low, which is really making the eyes look very tired. The brows cause a heaviness and a hooding of the upper lids. You see in this young lady, all we did was remove some extra skin of the upper eyelid because the brows were in good position, and she got a very satisfactory result. This lady, when she came to see me, had previously excess skin from her upper lid excised, but she looks tired. Her eyes do not look good because her brows are sagging. You have a heaviness, a hooding here, as well as extra skin of the upper lids. You see, when the brows are lifted, we get a more open, awake, alert eye, a happier looking eye without the extra skin. We have eliminated that extra skin by simply doing a brow lift. This lady is fortunate that she had adequate extra skin of the upper eyelids after her upper lid blepharoplasty, which enabled us to lift the brows. Sometimes we see people who have had their upper lids done, but we can't lift the brows because there's no excess skin of the upper lids and there's nothing we can do. So the brows should be done at or before the upper lids are done. 20 plus years ago, we developed a technique where we make an incision at the hairline for the brow lift. We call this the irregular trichophytic, which is hair, irregular trichophytic incision, which enables us to come down under the forehead skin and lift the brows to proper position. It also affords us the opportunity of maintaining good hairline position or repositioning, improving the hairline position. Many of the techniques used for brow lift will alter that hairline and alter them in an unfavorable way. So with the hairline incision, we can maintain or improve the hairline position. We also use that to reposition the hairline in a lady who has an extremely high hairline. This is a lady who had brow sagging, and she also had bags of her lower lids. We did a brow lift and removed the fat from the lower lids, and as you can see, we eliminated all of the extra skin of her upper eyelids and got rid of the bags that gave her a tired appearance. We're frequently combining the brow lift with other procedures. This is a lady who had brow sagging. We did a brow lift, and as you can see, we maintained good hairline position, and we also at the same time did a cheek lift and cheek implants. This lady presented to us with brow sagging, tremendous amount of extra skin of the upper lids, and lower eyelids with excess skin and bags. Now this person was intentionally staged in terms of her eyelid surgery. At the first sitting, we did a brow lift and did her lower eyelids. Then we came back about 6 weeks later and removed the residual excess skin of her upper lids. We never could have achieved this result without doing that brow lift. Again, brow lift, lower lids were done. This is a gentleman older. We did hair replacement surgery on him. After doing the brow lift, you see we eliminated all of these extra lines and sagging here in the temples. Did the brow lift, did hair replacement, did his lower lids, and did a facelift to get rid of the extra skin in the neck and reestablish the jawline that he had lost with aging. It used to be years ago when we were doing eyelid surgery, it was a matter of removing extra skin and fat. That basically described eyelid surgery. However, today we're not doing that. We're actually repositioning fat. We may actually add fat, sculpting the eyelids with their own fat taken from the eyes or from another part of their body. We may strengthen the muscles, lift the lid margins. It's about preservation and retaining or replacing the youthful fullness of a great eyelid. This lady presented, she had lost the fat here, and this sometimes happens with aging. She was a young woman, this was not due to age, but you see she's got a groove here that gives her a hollowness, a heaviness here. We simply took fat from another part of her body, in this case took it from her abdomen, and laid the fat in here to give her better lower eyelid contour. Hopefully I've given you a little insight in terms of how we approach eyelid surgery. If you want more information, please go to our website, which is www.bevhills.com.
You make me feel so young. You make me feel so spring has sprung. And every time I see you grin, I'm such a happy individual. The moment that you speak,